Hi Georgie.
Hiya.
How are you?
Good, thank you.
Are you all set?
Yep.
Let's go.
Okay.
Welcome to the X-ray suite. This is where we do the Allurion Balloon. I recommend you wear a gown because it can get a bit dribbly with the water. So if you just step into this back to front, that's it. It's like going to the spa. Okay, and then just take a seat. Don't need to tie it up, that's fine. Okay, and would you like a drink of water?
Yeah. Thank
Okay,
you.
so just drink so you're nice and comfortable.
Okay.
Right, Georgie, so now's the time to swallow the balloon, okay? So you've got to remember that this is no bigger than a piece of food that you would normally eat. So some of the worries are psychological as much as anything, all right? But I'll guide you through. So I'm just going to show you the balloon. Here it is in its package. So this is the balloon. Okay, so this is in a casing that will go into your stomach, start to melt, and then we can fill it up with this tubing here. All right? So what I recommend you do is hold it about here, head back, drop it in until you feel a gag at the back of your throat, and then just neutralize your head, nice and relaxed, and drink. And I want you to do continual drinking rather than sip and stop. Because if you sip and stop, the balloon may just pop back up again. So just keep drinking, and that's why we have the gown on, so don't worry about dribbling.
Okay.
All right?
Yeah.
So just to recap, head back, drop it in, little gag, head forward, drink. Simple as that.
Yeah.
And if you can't manage it yourself, we can help you get it down. All right? So just in your own time. That's it, head nice and far back, and maybe just do a dry swallow now. That's it, and head forward, and hand away, and big gulps, really big gulps. Now, a really big gulp now. We're almost there. Okay, so one more gulp and we're done. What a superstar. You've done it. Okay, all that worry for nothing, yes? Okay, so between your thumb and finger, hold it against your face, and just off to the side. Just off to the side, that's it. Yeah, got it? So I don't want that piece of tubing going in any further, so hold that tubing quite tightly, okay? Well done. And if we stand up, we'll take an X-ray. Okay, so what you need to now do is move back here, put your back against there, and we'll just get the X-ray guy to take the X-ray. Don't let go of that tube, okay? Okay, Georgie, if you take a seat back down. So we've done the X-ray and the balloon is in the perfect position. So it's sitting just underneath your rib cage in the stomach. So now we're going to connect you to this bag of fluid. So here you've got a bag of fluid which is 550 mils, which is a pint essentially. And then this is a pressure bag. So people worry that this whole thing is all water. It's not. This is all the pressure bag and this is the water. Okay? So I'm just going to connect up the ends. So keep holding where you are. Just going to connect that up and start that flowing. So you should feel cold water running down. Yeah. So I'm just going to pump this up now so that we've got a bit of pressure on it. And then you've got about 3 or 4 minutes just to sit there nice and relaxed while it fills up, okay? Okay, so that looks good. So fluid is there, it's flowing nicely, you're holding it in a good position, so just relax. Make sure your neck and shoulders are nice and relaxed. Just so you're aware, we did discuss this at your consultation, but this is the balloon. So that little pill that you swallowed is transitioning into this grapefruit-sized balloon. This thing here is the release valve. So at 4 months, this will disintegrate, then the balloon will just empty, and then you'll pass the casing. So you might not even notice you passing it. All right? 16 weeks, and then that will go. All right? So you're doing really well. Okay. You feeling that? We're coming to the final 30 seconds. You see that fluid level there?
Yeah.
So we've gone right down from the top here down to here, and that's just going to end here, and then we'll know it's done because this will stop dripping. So you're literally in the last 10-15 seconds now. Okay, so that's stopped dripping, and that's the last little bit there, so we just shut that off. You're all done. So I'll just get this bag out of the pressure bag now. So you can see the empty bag. So you've had 550 mils of fluid. So if you just drop this now and hold this, okay, and if you stand up for your second X-ray, just walk back towards the plate, and then we'll get the X-ray technician. Okay, so Georgie, we've confirmed that the balloon is in a great position in your stomach. So now it's time to get that tubing out. Okay, so if you hold this under your chin, I just put my safety glasses on. If you just look forward, and then what I'm going to do is just pull on this tubing. So open your mouth. Now in a minute your head's going to recoil back as it snaps off, okay, so just be prepared for that. Any second now it's going to snap off, okay? There you go. And it's all out, it's all done. Okay? So Georgie, just to complete things, this is your set of scales, digital body fat composition scales, and the watch, which is a health tracker. And all of these act via the app on your phone, and you can share the information with our dietitian. All right, so I'll just put these in the corner for you. Well done, Georgie. That's your second balloon in place, and the procedure all went really well. How are you feeling?
Good.
Good?
Yeah.
So what we normally expect is, just like with your first balloon, a couple of hours of honeymoon period where you're feeling fine. And then the symptoms are going to kick in. So we expect you to have 48 hours of feeling a bit crampy, a bit nauseated, maybe some acid reflux. That's completely normal. And we give you medication to minimize those symptoms. So already we've put the anti-sickness patch on you.
Yeah.
You've had a couple of the small anti-sickness pills, and that should help you get through this period. The other thing to bear in mind is that you'll get quite dehydrated, or potentially quite dehydrated. So while you're feeling well, just keep sipping, and you should get through that difficult period.
Okay.
So don't worry, everybody experiences that 48 hours, and then you're good to go for your second balloon. So just out of interest, Georgie, what was it that made you choose the balloon for the second time?
Well, I had like a really good experience with my first balloon, and I achieved really good weight loss with that. And I've got a holiday next year, so just want to get a little bit more weight off of that.
So obviously you will continue to work with our dietitians, and you've got the technology, so you've got the watch to keep keep track of your fitness, and you've got the digital scales which allow you to track your weight, your body fat composition, and share the data with the dietitian.
Yeah.
But what we're looking for is the long term. So what we want this, as you know from your first experience, is we want to change your relationship with food. We want to give you a healthier relationship with food, knowing, you know, what is going to sustain you for longer, what's going to keep you fuller, what's going to stop you snacking, and also give you some help to stop eating your emotions. So, you know, we're trying to steer you away from, you know, emotional eating.
Yeah.
And that really is the key to long-term success. So well done and good luck with it.
Thank you.